Here, optimize. It's recording. Okay. Hello, everyone. Today, we'll be discussing the social determinants of health and using the PRAPARE tool to address them. My name is Diana Zamora. I am the registered nurse consultant here at CRIB.
And I am Christy Tamel, the provider outreach coordinator at CRIB.
Today's objectives is we're going to define health equity and social determinants of health. We're going to discuss what is PRAPARE and how it can help address social determinants of health, what to do with the PRAPARE data, and how to address social determinants of health with internal and community resources and partners.
So let's discuss some definitions, the differences between equality and equity. So looking at the top image, that represents equality. So no matter your mobility, your size, or your age, everyone gets the same standard bike. But look what happens to everyone. Some people are uncomfortable with that bike. Some people are left out using the bike. Again, equal is sometimes not fair for all because what you may need is not necessarily what I need. Looking at the image below representing equity, if you need to be accommodated, if you need things to be customized, equity makes sure your needs are catered to ensure you reach your highest level of health. So the scenario I like to describe to highlight the differences between equity and equality is if you have a hungry and thirsty person in front of you, equality is giving both of those people food, where equity gives the food to the hungry and the water to the thirsty. So equity focuses on giving people what they need at that point of time. So applying that to healthcare, equality is giving everyone the ability to access healthcare, but we'll learn later that access to care is only a small part of what really makes you healthy. What we really want to do is achieve health equity for all. And why is health equity important? We'll later discuss the social determinants of health and how they can be barriers to achieving health equity. Public health thinks health equity is important because we believe health is a fundamental human right for all, regardless of who you are. So if we're able to remove these barriers, then we can influence people's health outcomes for the better. Health equity allows everyone to have the opportunity to enjoy life and pursue one's life plans. So how do we achieve health equity? Looking at the image below, compared to the last one we saw, you can see that the first one represents equality. Everyone gets one crate to see the game. And with equity, everyone gets what they need. So the adult doesn't get a crate, but the young ones get a couple more to help them see the game. But the last one is called liberation, where the wall or any barriers were addressed and then removed. So now no one needs any special accommodations because they can just enjoy the game as they are. So let's talk about how we can achieve health equity.
So Christy's been discussing some great examples of what equity looks like. But let's look at specifically what health equity should look like. And if you look at your triangle, starting at the red spot, you're going to look at that one describes to expand our understanding of what creates health. And in a way, that's what we're doing today by discussing social determinants of health. Then in the blue box, we look at strengthening the capacity of communities to create their own healthy future. And then the third one would be implementing a health in all policies approach with health equity as a goal. And you might be asking yourself, well, how do communities do this? How would our organizations or partners take part in this? And the first step is by understanding that improving health equity is not a job for one person or one organization. It requires a multi-sector partnerships and collaboration to create strong systems and to create a great foundation and support and coordination between your organization and other partners. So start by asking yourself, what will your community look like when equity is the starting point for decision making? So we have a brief little 3-minute video here, and it's going to provide you an overview of what social determinants of health look like. And while you're watching this video, I want you to consider where you live, where you work, where you play or your children play, and how that may affect your health.
Hi, and welcome to this video on the social determinants of health. This is a very important concept to understand because its impact on the health of individuals and of populations. We'll be taking a look at what it is, how it impacts health, and a useful framework to understand it. Take a look around you, your family, friends, and other people around you. What's clear is that health is quite variable, not just between individuals, but also across different population groups. Let's take an example. In 2015, the life expectancy of a child born in Sierra Leone was 50 years, whereas in Australia it was 83 years, a difference of 33 years. But there are differences even within countries. For example, in Australia, the life expectancy of Indigenous people is about 10 years lower than that of non-Indigenous people. Within a population, health is also influenced by social status. People with higher income, a higher level of education, and a better occupation have better health and a greater life expectancy. Health status can change as well. For example, studies of migrants have shown that the type of diseases, health behaviors, and risk factors are different in migrants compared to those in their country of origin. So why is there so much variability? To answer that question, we must understand the factors that can influence health. Let's have a look. A person's health is influenced by a range of factors called determinants of health. These include who they are, individual factors such as age, sex, and genetic makeup, and also what they do. This includes their health behaviors such as smoking, physical activity, alcohol use, and diet. Health is also largely influenced by the conditions in which people are born, grow, live, work, and age. These include their social and community networks, the socioeconomic, cultural, and environmental conditions that people live in, and also health systems. These are collectively called the social determinants of health. The social determinants of health are ultimately shaped by the distribution of money, power, and resources at an international, national, and local level. They have a marked influence on health inequities, which is the unfair and avoidable health differences between different groups of people within countries or between countries.
So we've been discussing a lot about barriers. So to remove these barriers and achieve health equity, we need to understand social determinants of health. So as you can see the definition on the bottom, it's conditions of one's environment that affect health outcomes and quality of life.
So let's break down the social determinants of health a little more. So what determines our health? What makes us healthy? So some will say biology determines our health. So you'll hear people say diabetes runs in my family, or it's my genetics, which is partially true, but that only determines only 20% of your health. So some people will say that their own personal individual behaviors make them healthy or sick. They'll say, I choose to smoke and that's why I'm sick, or I eat salad and that's why I'm healthy. That is also true. And we do have some personal responsibility when it comes to our health. Our personal choices only determine 30% of our health. But working more outwards with this circle and looking at the social determinants of health, you'll start seeing different conditions of your environment that can affect your health, like where your housing, your food, your work, and your access to care comes into play. So maybe you do have diabetes, but do you also have no jobs to buy healthy food? Did you not finish high school and that's why you can't find a stable paying job? Or maybe you live in a rural area where the nearest grocery store with any veggies or fruits is an hour away. And because of all these reasons, maybe that's why you eat at McDonald's, because it's cheap and down the road. So when you think on that train of thought, you are considering your social determinants of health, which actually make up 50% of your health. So basically, your social determinants of health are those external things that affect your health and quality of life. So think about where you live, where you work, learn, and you play. And how are the quality of those things? And are they making you healthy or are they making you sick? And in the next slide, we'll break down the different social determinants of health. And then the last outer circle, we won't get too into it, but the outer layer is called social determinants of health equity. So when you ask yourself, why do certain communities face poor access to education or poor access to food, you'll start to realize that different forms of oppression like classism and racism actually really influence how our country's systems are made, especially our healthcare system. But that is another talk for another time.
All right, so let's actually look at a couple of examples of social determinants that affect your quality of life. So where were you born? You know, location, like were you born at home with a midwife versus a hospital? And were you an immigrant? So the location of where you were born, like either with a midwife at home or a hospital with doctors and nurses on demand, you're born out of this country, you're an immigrant or a refugee. Based on where you begin life, it sets you on a path for health or maybe less health, less wellness. Okay, where do you live? Okay, believe it or not, your zip code is a strong indicator for health than your genetics. Just think about a rural farm, the high-rise projects in a larger inner city versus an upper-class suburbs. You know, put me in a different location and I'll have different health outcomes. So like examples of built and natural environment influences your health.
So education, where do you learn? Do you have access to education? And how's the quality of that education? Where do you go to school? Can you go to school? What kind of teachers do you have? Are you being set up for failure or success? So just think of those overcrowded schools who can't afford teachers or paper versus the college prep school who prime their students to become Ivy League students. So the amount of education definitely influences your health next to your zip code. So, and that's kind of the name of the game of this country, right? You go to school, you can get a job to make money, and money means access to resources. More resources mean more opportunities. So education is a strong social determinant of health. Another one is where you live, where you work. So job availability. How much are you getting paid? How's the employment rate in your town? When was the last time there was a new job opening? But do you have a job? But are you still paying living paycheck to paycheck? So these are different things to consider when you're thinking about how your work or employment is affecting your quality of life.
So let's look at some more factors that can influence your health status. Okay, where do you play? Do you have a natural green spaces just to have fun and play and relax? Are there parks? Are the parks safe? Can you walk down the street without feeling unsafe? Or maybe there's ditches and potholes everywhere and it's just a physical danger to even go for a safe leisurely walk or even a run. Again, talking about built environments, it's a social determinant of health. Where do you worship? Are there safe and open spaces for you to pray or practice? Are your spiritual needs being met? Do you have the freedom to practice your cultural faith? We know that incorporating spirituality into our wellness helps with our health. There's reports and studies that prove this. So if this is denied, then surely it would affect your quality of life.
Age is another social determinant of health. How old are you? How is age affecting your quality of life? Are you limited in your health services because of your age? Maybe you're getting denied certain services because you haven't hit that Medicare age yet. Or maybe you're younger and you're feeling you're facing discrimination at the clinic because you seem too young. So maybe they're denying you birth control, or you feel like you're facing shame at the clinic. So age discrimination is definitely something that impacts your quality of life and the experience of the patient and them coming back for care. And lastly, are you chronically stressed? How are you practicing self-care? Stress is a strong determinant of health. We all know stress kills. Are you able to practice self-care techniques to release that stress and tension? And we all know with historical trauma and grief, when that's not released from our body, it often manifests into illness. So make sure you're not brushing off those daily stresses in life, because those stress chemicals can build up and they end up leading to heart diseases and other chronic conditions. So again, that's another thing to consider, your quality of life.
So how can we prevent people from getting sick? Everyone kind of like in the public health realm, they'll discuss, they'll say something like, well, you'll hear, we need to look upstream. And when they say this, they're actually talking about public health and primary prevention. So let's watch a quick video again, and it indicates a classic public health story that illustrates the different levels of prevention.
There is an often quoted parable that tells of a man and a woman fishing downstream. Suddenly, a person comes down the river struggling for life. The fisher folk pull her out. Then, another comes and, again, must be rescued. This happens all afternoon, and the fisher folk are getting very tired from constantly pulling people from the river. Eventually, they think, we need to go upstream and find out why so many people are falling in the river. When they go upstream, they find that people are drawn to the edge to look at the river, but there is no safe way to do this. Many of them fall. The fisher folk go to the community leaders and report the number of people who have fallen into the river. They also report that this is due to the lack of a protective barrier on the cliff. Community leaders build a wall behind which people may safely view the water. Some still fall, but there are fewer victims to rescue. This is the moving upstream analogy for prevention. Instead of expending all resources and energy on rescuing people, why not stop the problem from happening? This is not to say that the problem can be totally eliminated, or at least not right away, but there may be fewer people to rescue downstream.
So when it comes to addressing a health issue, there's different approaches. When you saw the medical providers get involved, this is downstream. So they're doing damage control. There's already an issue and they're just pulling out the people who have been hurt and just trying to save them as they come. But when one goes upstream, where they walk to the ledge and think about how to prevent falls, this is when you start talking public health and primary prevention. You're thinking about building a fence so people don't fall, or educating signs so no one gets hurt. So in the next slide, we'll talk about different approaches to addressing and preventing certain health issues.
So let's look at an example of a patient coming to the clinic with elevated BP and see what types of strategies are going and how they're going to be addressed. And with each situation, as we bring it up, ask yourself, why is this happening? And based on where you are, kind of like in the river, this will influence the approach you take with this patient. So, situation, patient comes in with elevated pressure. It's determined that they need medication, so the patient is given medication. That is downstream. You're dealing with what the situation is right now. But if you ask the question, why? So you go up a little bit upstream with that why. And it's like, well, they came in when it was really like uncontrollable. So there was a lack of education and tools of recognizing what elevated BP can do to your body and what it feels like. So what would be the approach a little bit upstream is provide culturally appropriate health literature materials.
Why is there a lack of education? When you're asking yourself why this patient comes with an elevated BP, maybe another reason is that they you see that they have poor diet and lots of stress at home. And this is why it contributes to their elevated BP. Knowing that situation, you can have a more moderate upstream prevention approach where you would then refer the patient to see the nutrition and dietitian so they can reanalyze how they're eating, or maybe you refer them to a stress management class, whether that's Zumba or a walking class, to help them practice some self-care. So this would be a moderate upstream method. Rather than giving them medication, you're helping them prevent further elevated BP incidences.
So you start asking yourself, why did it take so long that now we have this person on medication? So perhaps this patient came in 3 times over a 12-month period, and they had elevated blood pressure, and it got documented, but no one really made a big deal about it, saying, oh, they probably just had anxiety, or did you just, you know, they didn't ask the question, did you just smoke like within the last 15 minutes, or did you have a whole bunch of caffeine? So it's gone undiagnosed at the clinic the 3 times that they've come by the clinic for the 12 months. And you're like, well, okay, so why is this happening? So you go upstream and you access the EHR data and the clinic workflow to determine, well, shoot, this is kind of happening quite often. We're giving people medication, but it shows that the last 2 times that they came in, they had elevated blood pressure, but no one did anything. Okay, so the approach is to access the data to see if this is happening in your community more often than not. So, and the real upstream philosophy is, well, there was no really policy or procedure at the clinic to say, okay, within the last 12 months, if they come in twice to the clinic and their blood pressure is elevated, then there should be a little red flag that shows up saying, okay, last time it was elevated when you came in, today is elevated, we need to have a little bit of talk of what's going on. Okay, so that's where the prevention comes in. So if we go back to the discussion we had about that little triangle about health equity, it would be implementing a health and all policies approach with the health equity as a goal. And the way you go really upstream is that there's a policy and procedure at the clinic to catch it the first time.
So yes, like looking at the downstream method, giving one-to-one patient medication has minimal impact. You go a little more upstream, maybe you're hosting a class, a stress management class for 30 people. You're doing a bigger impact there. But if you develop a very upstream methodology and approach to public health where you have a policy and procedure that anyone with an elevated BP is going to be treated this way, you're going to be having a larger influence and impact on your clinic and community.
A lot of the clinics develop algorithms that if, you know, they come in with a certain blood pressure, it, you know, you follow this little flow chart that tells you what the steps are, you know, to deal with this particular patient in that situation.
All right. So we talked about health equity, social determinants of health, and then what moving upstream means. So before we take any action in our clinic or community, it's important to collect data, because everything that we do needs to be evidence-based and data-informed. So we'll be talking about the PRAPARE tool, which we can use the data to better choose a selection for the health issue we're working on. All right, so what is the PRAPARE tool? It is an acronym that stands for the Protocol for Responding to and Assessing Patient Assets, Risks, and Experiences. It's a 2-page assessment that basically asks various questions about social determinants of health, basically what we were addressing a few slides ago. Questions about where you live, work, and play, just to identify any risk factors of patients that are related outside of the medical home. And this data helps improve programs and partnerships we want to build to better help patient care. So more about the PRAPARE tool. It was developed by the National Association of Community Health Centers. So they had reviewed several social determinants of health protocols and assessments and compiled these specific sets of questions. It can either be administered verbally or on paper or through your EHR system. They've piloted it in various health clinics throughout the nation, and many of them actually use NextGen. So this tool is successful in helping clinics and providers collect data to better understand and act on their patients' social determinants of health.
You started asking yourself, why is this important? It's important because we need a full picture of patients to provide them the most comprehensive and specific appropriate care that they need. You know, the intake form of demographics and clinical intake, it doesn't do this. Okay, so when you use this tool and you use it effectively, the results will help identify patients in your communities who need referrals and additional community services that perhaps you don't have the resources at your organization to provide them. So complex patients require complex solutions. So as we're learning about social determinants of health, it's important for you to understand that health happens outside the medical home. So it happens outside of the four walls of the clinic, okay? So just kind of keep that in mind when we're talking about the PRAPARE tool, health equity, and the social determinants of health. So the benefits of PRAPARE, okay? By asking patient-centered questions about risk and allowing the patients to prioritize their needs, you empower them. You empower patients. You know, by giving team information for counseling and referrals, you know, you give the care team complete context of the patient. So you're improving point of service care management, you're improving patient population health. Gathering data to inform, you know, where to best use the resources that you have and what other services do you think we need to have, okay? Otherwise, you're just taking your best guess, you know, and you don't want to be guessing about your community. You want to know what your community needs are, okay? Data can inform and promote legislation and policies. Again, going back to, you know, starting health equity at your policies and procedures. Okay, so you're using data to create partnerships with clinic, community, and government agencies, or even within your own organization. You have partnerships for referral and opportunity to share meaningful data in your community, okay? And you gather data to negotiate for sometimes for patient. Perhaps you're already delivering a certain kind of patient-centered care, but you're not getting reimbursed for it. There's a lot of opportunities if you do the same thing, like the diabetes lifestyle coach trainings. You know, those are reimbursable now. So it's just an opportunity for you guys to create community programs that best serve the community that you have.
All right, so let's review the PRAPARE tool even more. So you all will be using the AIAN specific PRAPARE tool. So that has 28 questions. And this tool can be administered in many points of the clinic or outside the clinic to collect data. Make sure you consider privacy, who will be administering it, what kind of communication skills, which we'll kind of talk about later in PowerPoint too. But these are the different points of data collection you can consider. The waiting room, that's a point. When the patient has already been roomed and just waiting for the doctor to come in, that's a good data collection point. During their check-in visit, when you're doing outreach and home visits, you might want to consider how you will incorporate a mix of patients and community members in your data collection. So that would be a call within your clinic and your project coordinator for the ACORNS grant of who your population will be. But there are various locations where you can collect data. So here's a screen capture of what the AIAN specific PRAPARE tool looks like. It's 3 pages. It looks similar to the original PRAPARE tool, where it talks about housing, transportation, and your social support, but the American Indian Alaska Native specific questions also address culture, your access to green spaces, and sexual identity. So when you are starting to prepare to implement the tool, here's some things to consider with your team and your clinic and your administration and your leadership. So what are your goals and your benchmarks to know you are on track when it comes to data collection? So we suggest you refer to your work plan and work with your ACORNS project coordinator to determine what is the number of responses you need baseline and by when. Integrate the tool into your workflow. So start implementing it by talking to your leadership and your administration to make sure there's buy-in, that not only you and your team are bought into the PRAPARE tool, but everyone else in the department and everyone else in the clinic. And you need to determine who will be administering the tool. Are they going to be CMAs or CHRs, the RNs, and where are these going to be done, inside or outside of the clinic, and how it's going to be done. And lastly, when you do start collecting data, how are you going to track it? How are you collecting it and keeping it safe and private? Some are collected through the EHR system like NextGen, or you can develop a tracking tool similar to the ones we'll share in a few slides through Excel.
So let's look at a couple primary steps to the actual implementation of using the tool. So one of the first steps is develop your outreach plan. Who is the population? What is the goal? What are going to be the strategies, your methods, your location? Not only location of where you're going to give it, but the location of your data. You know, are we going to buy incentives to get people to come over to our table and actually take this PRAPARE tool? What are going to be the staff responsibilities? Who's going to be responsible for going out and doing this? Not only collecting the data, but also, you know, actually putting it in some kind of reporting template. Okay, and then work with your ACORNS team for specifics of, you know, of what's the percentage of your patient population that you are going to be actually required to actually perform the PRAPARE tool with. Okay, and then after all that data and you collect all your data, then you're going to develop a written resource guide of what kind of community-based social support resources are out there based on the needs that come out of your PRAPARE tool. And of course, part of this is once people are getting in the referrals, you develop a system of the tracking of the referrals. I mean, that's very important, because if something's falling through the cracks, like, you know, say you're sending them to a certain food pantry, and then that food pantry closed, but no one told you it closed, and then you're like, well, no, you know, they come back.
People.
Yeah, you keep referring people. So it's just kind of like, so see which referrals are working and which ones are not, and you keep a little simple Microsoft Excel template on that. And then, okay, so let's talk about collecting and organizing the questionnaire results. So some of you that have NextGen, there is NextGen actually provides the PRAPARE tool, but you're going to have to tweak it for the actual tool that CRIB developed for you. So it's going to be something that you either contact NextGen or figure out how you're going to do that. Another option is if someone is an Excel guru at your organization, they could develop a template for that. And then of course there's other tracking software. But again, coordinate with your ACORNS project coordinators and your team to discuss what options are available to you.
So this is an example. If you do choose to do in Microsoft Excel, it's kind of, if someone knows how to do the formulas, you put the question, drop down menus of yes and no. So while you're manually inputting data like this, they can also pull this data to create reports through a pivot table, which would look like this. So each question would get a report like this. So for the how often do you see or talk to people that you care about and feel close to a question, you would get results of the counts of how many people said what answer, and then a percentage breakdown, which is good for at a glance view. You can see that, well, 34% is saying they've only talked to one person less than once a week. So this is a good, easy, straightforward way to track data results.
Okay, so let's kind of like talk about, we asked the questions, now what? So we're giving you an example. Say you develop 50 PRAPARE results, and 60% of them saying they're facing food insecurity. 25, some kind of domestic violence. 35% are unemployed, and then 60% of the elders see and talk to someone less than 1 time a week. Okay, so you gathered the information, you prepared the questions, you gathered the information, so You assess the needs. Now it's your responsibility to respond to the needs. So that's where you create a community resource guide. Okay, because if we go back to what we talked about, health equity, it cannot just be one individual or one organization taking care of a whole community. Sometimes that doesn't work, guys. So going back to your team is like brainstorm. What are current resources? You know, whether they're in-house or out-house, you know, outside your clinic. Meals on Wheels, food banks, hotlines, home visitation, community events, okay? Research for more. Look outside your clinic and organization. Look at county programs, other nonprofits in the area, other health centers, okay? An example could be a food bank or even like a SNAP county services, okay? Organize your information, the template that we showed you recently. And then review your product with your team. You know, maybe people know other resources. We have a great example of one of the clinics that we've already done this with. And when they started collecting this data within just in-house, they were like, what? We offer that? I didn't know we had this. Well, I didn't know we had Zumba during the lunch hour. So it was really eye-opening to someone who had been working there for 5 years to know that they had all these resources in-house, but no one had actually collected the data and put it together in a resource guide. So again, collect the data, evaluate your data, assess the needs of your community, and respond to the needs.
And not only just share your resource guide with your patients, but also share it with everyone else in the staff and other departments. Because I'm sure if you didn't know, other people in your department or at the clinic may not know as well.
So this is just kind of like a simple community resource guide template that can be created, and you have location, the key contact, services that are provided, their hours of operation, and any kind of additional information. So it's just basic information on the resources that you're gathering, who's responsible for, creating this, who's going to have access to it, who's going to be calling on a quarterly basis to see if this particular, say, food bank is still open. Have they had turnover? Is the lead contact different now? So, but I mean, if you keep it simple, it will work for you in the best.
So with all this data, make sure when you're brainstorming solutions to think out of the box and be creative with the resources you have internally, and don't be scared to tap into the resources you have externally around you. So for example, we're going to use food insecurity. You had 60% of people who say they're struggling with feeding themselves. So there's different levels of intervention. You can focus on the clinic, the non-clinical, or a public health prevention. So for the clinic interventions, to be creative, with addressing food insecurity, you can start focusing on health education on nutrition. Maybe you can encourage providers to hand out food vouchers at the end of each clinic and maybe go across the street to the farmer's market. Maybe someone can take initiative at CHR and see which patients are eligible for different food programs and benefits and start signing them up. So those are some examples of clinical interventions.
So, and also one of the clinics, they've actually developed their own little food market, and the doctors give their patients, or if they get education, they get these little, what they call native veggie bucks, and they go over to their little farmer's market and get $5 worth of vegetables. It's a fantastic project. So non-clinical, of course, you could start a food pantry. You can start a little farmer's market once a month. You can build a community garden and partner with local food banks. People are always, ready to, to partner with you guys, okay? Prevention, you can work with schools for free and reduced student meals. We've heard a couple of examples on NPR, maybe on Facebook, where somebody will go and say, we want to buy, 2 months worth of lunch, or pay for some, somebody's lunch for the next 2 months or for the next year. Okay, you could be an advocate for more green grocery stores and farmers markets in your area, and of course, see who can be given Meals on Wheels program, who's eligible for that.
So you may be doing this already or might be planning to do so in the future. But remember, it's okay to think out of the box and ask yourself, what are the gaps between medical and public health, and how can we fill those in for our community members and patients?
Okay, outreach to staff. So this is a discussion of how you outreach to people within your organization. So make sure to educate, inform clinical staff of the changes that are happening, the importance of what public health is and social determinants of health, and it's necessary to collect data to make better informed decisions for patients. So organize a lunchtime informational system, or say ask your COO if you can have 10 minutes during your next general staff meeting to present on this grant and the evidence of how social support improves health, or to introduce a referral process. Have any outside organization come over and present during your general staff meeting, 5 or 10 minutes of the resources they have for the community. So just invite all staff, especially your clinical staff, and screen the patient schedules that people allow you to say, hey, I want to do some outreach today. Can I table in the lobby, and can you tell me, how the patient schedule looks? Are we going to have a lot of patients in today? And things like that. See if the medical care team will let you take part of the huddle. That way you know who's coming in and what's going on. And close the loop, always.
All right, so you're starting to inform the staff about changes when it comes to social determinants of health and starting to collect data. But it's also important to start outreaching the community, because you'll be asking them the questions and pulling data from them. So it's good you start preparing them for change. And make sure there are things you can do to start feeling more comfortable in communicating with the patients and community topics and sensitive topics. There's motivational interviewing workshops you can go to. There's different health coaching workshops you can go to. It's learning how to navigate personal sensitive topics, especially when patients or community members may give you difficult situations as well. So it's good learning how to de-escalate and have effective communication skills.
Definitely. I mean, the message is very important, but how you deliver the message is 10 times just as important. Okay.
Yeah, so just informing people about the PRAPARE tool, what it's collecting, social determinants of health. They're going to ask you, why do you want to know where I live? Why do you care if I have a park near my house? This is a good way for you to educate them on how that actually impacts their health outcomes.
So, as you can see, within an organization, different departments and different resources. So you look on the right side, you have, in our regards, it's not a hospital, it would be a clinic. Then you have pharmacy, you have the mental health department, you've got dental, you have home health where your CHRs and public health is going, and then you've got other specialties going on. And in the middle, if you consider all those, is the patient-centered health home. That's when you're looking at the entire patient. And you have to take into consideration now the health home, the social determinants of health. Okay, so you look at what's going on in your community work-wise, what kind of faith-based organizations, the schools, public health and assistance, and other community centers that maybe your patient population is also entering. But what the beauty about this, and you working in a community clinic, is that you can be the bridge for each direction. Those schools or those work or the community centers can say, hey, I heard in this clinic they have really good mental health care. Okay, vice versa. Say in the dental or mental health care, oh, we don't offer that here at our clinic, but however, we heard about this public health assistance program that could probably help you out with that. So again, it can be anyone. It can be a provider, an RN, an MA, CHR, behavior health, admin. I mean, it can be anyone that can be a bridge in providing the best care for your patient population.
So here's some tips and tricks to consider when you're outreaching, both in the clinic and in the community. So the PRAPARE tool does have sensitive topics, so please be prepared to communicate with patients. So a basic common rule in public health is meet people where they are. It's not forcing them, because you will definitely get resistance. It's just working with what the patient is giving you at that moment. And if most of the answers are, I decline to answer, then you're going to check 10 boxes of decline to answer, and you're not going to force anybody. Always be coming from a space of respect, and also listen to the community needs. Remember what your mission is. It's to collect data on the community to better serve them. So you're putting their needs first. And you're going to be able to do this when you can build a sense of trust and a strong foundation with them. Of course, you might be new and they might be hesitant, but once you start building that trust of just being open and listening to them, I'm sure you'll be able to get the information you need to better serve them. Some other things is too, they might have questions about certain topics about, hey, I do have problems paying my light bill. So be ready to offer service and information, not just to what your local clinic is referring, but other locations that may be outside of their traditional times. There are people with different work hours, with family obligations, school obligations, so be flexible with them too.
Yeah, whatever information that you develop to hand out, that you make it friendly and easy to understand. Public health rule and health literacy rule is 6th to 8th grade level. Reading level is what you should be printing all your documents in. And of course, provide information in the primary language of those who will use the service.
So that was a lot on the PRAPARE tool, but now we're going to start talking about solutions, addressing social determinants of health with community resources informed by all the data you had collected. So before we go into an example of what to do next with your data, I just want to review some strategies that can be used with the data. So this graph shows what action to take based on how many resources your clinic or your community has. So on the bottom left corner, so in this situation, you have a few clinic and community resources. So what are you going to do then? The best thing to do is mostly education. You're raising awareness of social determinants of health. Talking about why it's important and how air pollution, lack of education, or no jobs can affect the patient population's health. So not everyone in the medical field has this perspective, so be able to create opportunities for the staff and leadership to discuss this. So again, like Deanna mentioned, maybe a session during the all-staff meeting about what public health is and why it's important. The top left corner, so you have few community resources, but you have many in the clinic. So what you can focus on is actually creating in-house services since you have so many at the clinic. So this is where you can develop a referral system back to your public health department, where you can provide additional community support, signing people up for WIC or Meals on Wheels, different community sources. With your bottom right corner, so you have many community resources, but you don't have that many clinic resources. So this is when you start going outside externally and start creating partnerships with other organizations. You're finding grants that support with what you want to do, and maybe you're tagging along with an organization already doing this work. So this is when you wouldn't want to reinvent the wheel, but partner. And again, it's okay to work with external organizations and be strategic with your mission with it. And then the top right, this is what you guys are kind of doing. You do have a lot of community resources and clinic resources based on this grant. So this is when you start building a lot of coalitions, whether that's internally or externally. And this is when you'll be collecting data and using that data to inform your processes in the clinic by creating a resource guide and creating community linkages as well. So this is what a lot of your CHRs and ACORNs grant staff people will be doing with the PRAPARE tool.
So, examples of referrals, collaborations, people can join and create coalitions within the community. And again, think outside the box. You have TANF, you have utilities, you have Head Start, you have fitness classes and centers, parenting skills, There's that Family Spirit program that's out there. There's educational scholarships. There's transportation, that stress, anger, resilience classes. So again, you don't know what you don't know. And part of this grant is to get you out and researching what's available in your community. You know, how can we offer more resources to our patient population?
All right, so now you're ready to start collaborating and forming an external partnership with an organization you really think you can get along with. So these are kind of the steps to forming that external partnership. You've already maybe hopefully identified key partners when you were collecting information on your community resource guide. So who are those agencies you are interested in partnering up? Then go ahead and form that connection, whether you reach out with a phone call or email, but make sure you follow up. And when you establish that relationship, make sure you make your name and your organization familiar.
And find a common goal. Do you have goals or a mission statement that align with each other? You know, do you both work in tribal communities? Are you trying to end hunger within your communities? What's a shared vision? Okay. Develop a plan, whether it's a big or a small plan. Write it down. Be flexible with it. You know, what are the action steps to meet our goal? And then again, maintain and evaluate your partnership. It's like any other relationship. Reflect about how it's going. You know, are you going to stick around with it? Are you going to end it? Are you going to grow it? You know, are you going to cut back the effort? I mean, again, just because you go into a relationship with an organization, you've got to see if it's working for your community. Okay, so the key takeaways is that's important for us to expand our understanding of what creates health. You know, our hope is to change the leading story that health is determined mostly by medical care and personal choices. As we learn today, that is not true, okay? We want to strengthen our community's capacity to create their own healthy future. Okay, so we need to acknowledge that communities themselves need to be involved in creating the policies and systems that improve conditions for the residents. Again, if you base your community at the very beginning with taking health equity into effect, it could be a completely different community. And then take a health in all policies approach with health equity as a goal. By taking a broader view of what creates health, we can better understand how policies related to transportation, housing, education, public safety, or environmental issues can affect health outcomes.
All right, everyone, I hope you enjoyed our overview of the PRAPARE tool and social determinants of health and health equity. But if you need more information, please make sure to contact your Acorns team, Ephraim or Julie, and here's their contact information.
Thank you for your attention. We hope you have a great day.